Something to Chew On is a podcast devoted to the exploration and discussion of global food systems. It's produced by the Office of Research Development at Kansas State University. I'm Jay Weeks, PhD candidate in the Department of Agronomy. My co-host is Scott Zanona, an associate professor in the Department of Philosophy who specializes in the philosophy of science. Hi everybody, we're glad you're back. The field of human nutrition is fascinating and obviously important, but as we all might imagine, very complicated. It seems like almost every day there is press coverage of a new study concluding that something, like coffee or chocolate, is good for you or is going to give you cancer. Scientists and doctors have learned a lot over the years to keep us healthy, yet many questions and seeming contradictions remain. So how do we make sense of all this? One way is that we can all buy all the books and read all the papers to make decisions for ourselves, but many of us, even if we would like to take on this endeavor, sadly do not have the time. Fortunately, another route is available, and that is that we can rely on specialists that spend their careers assessing all the information and distilling the findings down into recommendations that they then provide to us through various means. Our guest today is Dr. Sandy Procter. Sandy is an assistant professor and extension specialist focusing on maternal and child nutrition in the Department of Food, Nutrition, Dietetics and Health here at Kansas State University. A registered dietitian and former coordinator of the Kansas SNAP-Ed Nutrition Education Program, she possesses a wealth of knowledge surrounding human nutrition that spans from pre-pregnancy all the way through advanced age. Our discussion was quite wide-ranging, covering some more technical topics relating to maternal health and breastfeeding, to more social considerations of how to demonstrate healthy eating habits to children and providing recommendations to adults. Regardless of your background, I think everybody can find something interesting in this episode. Our Global Food Systems Initiative Coordinator, Dr. Maureen Olebnik, joined Scott and I for the interview as well. She has a strong background in cereal chemistry and brought an additional perspective to the conversation that I think you will appreciate. Lastly, if you are enjoying the podcast, please tell your friends, either in person or on social media. Word of mouth is an important mechanism by which we grow our audience. Also, if you wouldn't mind taking a moment to rate us and leave reviews on whatever platform you happen to be listening on, we would be most grateful. We want to continually improve the program, and your feedback is a tremendous help. Okay, sorry for the long intro. Happily, we now bring you Dr. Sandy Procter. Enjoy. Dr. Sandy Procter, welcome to the podcast.
Thanks. It's good to be here.
So we usually start off with a short intro before the podcast is even recorded, but we always like to get your perspective on your background and how you got here. So if you don't mind, could you tell us a little bit about yourself?
Sure. I'm originally got my bachelor's from K-State in dietetics way back, and started on what I thought was a traditional career path for dietetics in a clinical setting, and progressed through a variety of different dietetics positions, each of them still long-term care, and then feeding college students and infant and child feeding programs. And each of them, I realized I was sort of embracing the idea of moving further back. I wanted to move back further to make a difference earlier. And so I went from basically instructing patients as they were leaving the hospital about eating more healthfully to ultimately, when I completed my PhD, working with maternal and child nutrition and actually beginning to understand that we can really affect change earlier than before birth, and also beyond just a single generation through some of the genetic differences that we know that adequate or inadequate nutrition can make.
Yeah, so I definitely want to get into the maternal and child health things. I think that's really important that a lot of people will be interested in that. To get you into that, when you started moving closer and closer to childbirth, were there things that you were noticing in society or in people that made you, sort of key on that, or what got you interested in that specifically?
Well, as in a role of nutrition or dietetics or in healthcare, you realize that so much of what we do is focused on people's health or correcting something that's wrong with people's health. And so so many of the chronic diseases that we deal with are nutrition, food related, that it is just a real goal, and I think of many people who are in nutrition related work, to catch that audience at an earlier time, to get to them and help them understand how valuable changes can be earlier in their life. So if you're a parent, how starting your child with that right kind of food is essential. Or even earlier than that, talking with mothers about breastfeeding the minute that their baby is born. And so those were the kinds of nutritional interventions that really captured me as I sort of progressed through my early work career.
So most of your work now is as an extension agent with K-State, correct?
Extension specialist,
Extension
right.
specialist, sorry. So what does that mean for people who aren't familiar with the extension system?
Well, and that's why I wanted to tell you why I corrected those. Agents are our educators that are out in the field, and they are in Kansas, housed in every county, and they cover a variety of subject matters, topics. Generally, they may be community development, or they may be agriculture and natural resources, family and consumer sciences. And then specialists are faculty members at the university level, usually, or regional level, that are subject matter specialists. And we provide programming information, resources for those extension agents that are out interacting with local audiences.
Your specialty is maternal and child health mainly, yes?
Nutrition. Mm-hmm.
Nutrition.
Mm-hmm.
So what are some of those things that you're doing? What does a day look like for you, or what programs are you working on?
Well, for many years in this role, I worked as coordinator across the state for 2 nutrition education programs, both the Expanded Food Nutrition Education Program and SNAP Ed. And both of those are aimed at low-income audiences to help them better utilize what limited resources they may have, better feed their families, and to follow as closely as possible optimal eating information, helping them learn how to cook if they aren't able to do that, to use some of the healthful foods that they may not know how to incorporate into their diets. So really complete sort of nutrition education for themselves, their families, how to shop, how to keep their food safe. So kind of all information around that. And so that really fit well with my research or my focus area on maternal and child nutrition, because those programs really focused at the homemaker who was trying to better feed their family and to stretch that food budget and to make better decisions that was going to, affect the health and well-being of the people in the family.
So you mentioned sort of supporting agents, but could you say something more about these programs that you're working on? This isn't all just sort of for agents out there. Are you contacting the public? Are you working sort of on your own too, right? So,
right.
yeah.
Those 2 programs I mentioned are both USDA programs
right.
that are delivered in Kansas through Extension. And so we are the sole teachers, the sole delivery agents of both of those programs, and they're delivered in about 80 counties for SNAP Ed and about 10 counties for the smaller program, FNEP. And so as the specialist supporting that, and the coordinator was really a lot of just program management across the state. And there are of course, both of them are based with the information that comes out from USDA. So My Plate and the nutrition information that is developed. My Plate is the basic pictorial embodiment of the dietary guidelines for Americans. And so both of those programs are based on getting that type of information out to audiences, and in a variety of different ways, in different curricula. And so specifically what I did as coordinator of those programs, and this was until 2018, was to really coordinate the efforts and the direction that our programming took in specific areas identified by the local programming, but then facilitated through the state. And supporting the agents and the educators with the tools and the information that they needed, and the training to keep them so that they were able to deliver those programs soundly.
So one of the benefits of it being on a county by county basis is you can target specific programs to benefit the people in that specific county, correct?
That's one of the beauties of Kansas and the extension in Kansas. It's very locally driven. If you were to compare what a specialist does in Kansas versus other states, in many states, from what I understand, it's kind of top down. We would decide at the state a program that we wanted to send out over the state, and everyone would do a program on this topic. In Kansas, because it is locally driven and there's that local funding and that local board that is really driving some of the direction that extension takes place in, those local needs are going to be identified, and then as specialists, we help agents realize what resources might be available to meet that through a series of lessons or through information provided to stakeholders or whatever they might identify that they need. So it really is challenging for both, I think, maybe specialists for sure, agents probably, but hopefully is a much more flexible system for the stakeholders and the people of Kansas.
You had mentioned a local board, and I don't know that I may have missed the definition of what that is. So who would be on that board? And is that true? Is there a local board in every county working with the agents?
There is a local extension board that supports every extension office, and there are extension offices in every county and now districts. And so that may be a district board if there are counties that have gone together. And that even is through a change in Kansas law that they would join together as an extension district. And then there's a board that guides their work and the hiring and the oversight of those programs. So our extension agents they have input from the state, but they also have input from local stakeholders, and then that local board.
And who makes up that board? Is it local
people who are elected
well?
to?
Elected to
they're
it?
elected to the board, and people who are interested in what extension has to offer. And extension, oftentimes people only know maybe about 4-H as part of extension, and so there are people who are interested in youth development and people who are interested in and focused on community development or health or water. The global food systems is one of the grand challenges, but probably one of those at least challenges is going to be a focal area for people who are interested in serving on this board, or people who are just really interested in seeing a vibrant service in their communities for the well-being of what can happen when extension is really involved and informed.
Could you just say something about the way, what extension is doing here in Kansas versus in other states? So you described how it's different in terms of the locality, but is this is anything like this? Is this everywhere across the whole United States? Every state has universities working, with extension agents throughout the state, or is this sort of just in our, breadbasket areas, or how does that work?
That's an excellent question, and I should broaden my description here. We are, in Kansas, the Landgrant University. There is one in every state. That was set up by Morrill. Justin Morrill, I think is his name, back in the 1800s is when he first started, 1860s, I think. It was Abraham Lincoln's idea to have land-grant universities. He thought it was important that the average person that was not able to necessarily go to a university have the benefit of the excellent work that was being done at a university. And so he had this idea of land-grant university, and then Morrill was the person, I believe he was a senator. He was definitely a congressperson that was involved with many times proposing this and getting it to actually come to fruition, and getting a piece of land in every state put aside for land grant universities. And now in many states there are sea grant, air grant, lots of other types of universities that do that same research, and then make sure that research, part of that research challenge is to disseminate that out to the people of the state.
and it's a key part of Kansas State's mission, right?
It is
Obviously,
a huge
is to do
part
this.
of
Yes.
that.
Yeah.
And we find ourselves in today's conversation, oftentimes you'll find us packaged into the discussion around engagement, because extensions work is truly engaged work. And so getting back to the topic today with the global food systems, it is important that we look at the role that K-State has with all the amazing research and the connections out across the globe, as far as developing the information and discovering all the amazing science that's there. But it's also, at least in our estimation, that engaged part, that taking that information out to the consumer, whether that be individual families in the most rural part of Kansas, or if that is some sort of community setting where we can change the environment and really make it a healthier situation, because we have agents that are working as part of the school wellness committee, and they're going to have healthier food served at vending opportunities. All of those types of opportunities, that engaging and changing step by step the possibilities moving toward health is what the role of extension is, either directly or indirectly, but aiming at those sort of components that allow us to have a healthier life.
And I think, you were talking about kind of education and providing information a lot, and I think it's really easy to see like the job of the land grant and of extension as sort of serving that role, and it's kind of core, right? Sort of information, but I like the way you're focusing on engagement there too, right? Because there's a lot of this that isn't just about here's some information, let me give it to you. It's about, like you said, working with people and getting them interested and involved. And I mean,
yeah, and that's
agents are doing things too besides just providing information.
Absolutely.
Right? Yeah.
That's the classic model when you think back to it. Let's take it, around the 30s and the Dust Bowl era, and those agents out there teaching people how to, and I'm out of my element here, but circular plow, say, and prevent the wind blowing and the erosion and some of the things that were the real one of the real parts of the problems to the problems with the Dust Bowl. And part of that was education, but part of that was application too. It wasn't enough just to say, oh, I need to eat more fruits and vegetables every day, but an understanding of not only do you need to eat more, here's how it could happen. Here are some samples, and you can tell your kids really like it, and this is a recipe that makes it really easy for that to happen.
In your opinion, what are some of the best ways to engage the public?
Well, I think that's a challenge that is ongoing with us. And when I first started being interested in extension, I was just a kid. I was in 4-H, and to me, it was just fascinating to go to the extension office and see all those brochures that were written. Most of them in food and nutrition were written by the same person. And it was like, who is this amazing person with these credentials that can write all this amazing stuff? And it all fits, it's color coded. It fits in these little holders. And it was just the coolest thing. Well, that has changed, obviously. We don't do a lot of print information anymore. We do some because that's still a way that works for people, but we do a lot of electronic information, and we do, blogs and all sorts of more modern, with some of our young pregnant moms in some of our nutrition classes, we do tweets, or we do YouTube Live, or whatever the form is that can really make sure that it is effective, because it's just like nutrition isn't nutrition until it's eaten. Information doesn't do any good until it's received. Communication is two-way. So it has to be received as well as sent. So the best way is what is going to work best for the two that are communicating, whether it's the sender, but the receivers as well. So we'll find sometimes that we have multiple ways in the middle of programs, and depending, if something spans generations, that's not atypical at all. Or it could be that we start everybody off with face-to-face, because that's going to really build some rapport and some trust, and then we may go to online so that this young mom can get that last 2 or 3 lessons after she puts the kids to bed. But we still have that face-to-face touch with her, and she knows this and knows who to contact if there's questions. And so I think Extension works really hard to identify what those best methods of communication and information delivery are.
So K-State does a lot of work internationally through the Feed the Future labs, through many other activities where people are traveling. How does that affect the extension side of K-State's outreach? Do we have any overlap or any connection between some of those international activities?
We do have some, and I imagine there are more in agriculture proper than I'm even aware of. But I can give you an example of one that I was really fortunate to take part in just a few years ago. And I was approached by Sajid Alavi with the Feed the Future work that he was doing. And he was interested in developing a new food for very young children that would be replacing the corn-based food that they had used in aid programs. And it was going to be sorghum-based. And so there was a lot of work being done on what that would look like and what all else that would include and the recipe for that. But also they were interested in information of, how can we work with these young moms and how can we build their trust and what all do we need to know about, we're grain scientists. We're not that familiar with young children nutrition. And so I was brought into that project very early. And I have a background from an earlier project of working in Kenya with doing some nutrition education. And so thought that maybe some of that information might be transferable as we started to learn about working with rural families in Tanzania for this Feed the Future project, and also with the community health workers who were sort of our go-betweens and made it all possible. They could translate. They had relationships already with the families, and so that's sort of that extension role developed for us. So we weren't just walking in there like the experts and, trying to change things or offer them, food for your babies. You'd be very distrustful if you're given a food for your baby, but we worked with the local health educators to build that trust, and they could start to see a real benefit to their kids. They really showed health benefits right away. And so then we had a role at the end to work with those same health educators to make sure that the moms knew what to do next, because when the project ends and the food source goes away, the moms want the health benefits to remain. And so to have those discussions with folks who worked as our outreach people, we had some sound nutrition information, but they had knowledge of local plants and inexpensive fixes that maybe families didn't typically use to feed their family. A lot of times historic plants are so nutritious but are thought of as poor people's food or fed to the animals and not eaten the way they were even a generation ago. And so when you have a child who's in a really healthy situation and looking good, and you have a health educator who's saying you can keep your child this active and healthy by adding these things, these simple things to his diet, you have a motivated, engaged listener that's ready to say, I can make these changes because I see how it's going to work, and I'm moved to keep my child healthy.
To drill down into this project a little more, what were the health challenges that were presented, and then how did you move into correcting those?
I was a part of a big team, and so I need to talk about that because it was a really visionary group of people. We had Sajid, whose work is with, of course, with grains and extrusion. He was extruding the grain, meaning that it was being pre-treated so it cooked faster. And one of my experiences was in Kenya is that one of the things that is extremely hard on the natural surroundings but also expensive is fuel, cooking fuel. So if it cooks more quickly, that's a real bonus to the family. They don't have to go out and collect wood. They don't have to buy food. They don't have to spend a lot of time cooking. So that was a real benefit. So you had this extruded product, and then we had also from our Food, Nutrition, Dietetics and Health department here at K-State, we had sensory specialists who were able to do all kinds of testing to make sure not only was this a nutritious food that they were going to get, but it was by far one of the tastiest things that they'd ever come in contact with. And
Added
really,
bonus, right?
really helped, because when you're trying to get people to try your food and to taste your food, you want to make sure that it is even more attractive than what they're used to eating. And then another one of our group, also from our department, was Brian Linshield, working with the lab, the basic nutrition, and finding out how can we formulate this food so that it has increased nutrients. It's very digestible. Sorghum is historically not real digestible, but when you extrude it, that helps the digestibility. And then mixed with some of these other products, it increases some of the attributes. And then the whole micronutrient array that was added to it to make it so it would overcome some of the main problems, which were vitamin A deficiency and iron deficiency anemia. So lots of efforts went into it, even looking at the feasibility of, with some of the agricultural economics folks that we worked with, Nina Lilia and her students, doing a study on the feasibility of making this extruded product, because it was USAID in addition to USDA. Yes, we can make it here in the United States and ship it, but what would be the feasibility of making it in country and making it a sustainable type foods at some time in the future? So there were multiple aspects to it. And so seeing what the costs of those grains, either grown or purchased, and did you know that they had extruders in, I think it was in Kenya, not in Tanzania, but right next door. So just learned an awful lot and found out so much about working with it. Our partner in country was a non-governmental organization, an NGO, and the ability to get an IRB through a foreign government when you're working with young children is not to be missed. If you think you've done science, that is a lengthy process.
And for those who don't know, an IRB is what?
Internal Review Board, the permission that you get from, in this case, the government and all the layers of the government in Tanzania and the health agencies, as well as our university, to make sure that every step of what we're doing treats people and processes and all parts of the system with respect and very above board, so that ethical research is being done all the time.
Were there any learnings from that experience that you were able to bring back that had some impact here in the state?
It's really interesting that you asked that, because obviously there were, the bigger project ones were the huge ones related to the grain and the sensory, and I think it's gone on and sort of continued growing. But for me personally, one of the things I learned was then coming back and working with those low-income programs is you don't know what low income is until you try making connections and finding support systems outside of this country, because the support systems that we take for granted, whether it's, the WIC program and I shouldn't say that we take those for granted, but that are here and part of our structure, are so non-existent. Food stamps or SNAP, as we have it, those things that are there when a family simply isn't able to have enough money to feed themselves. There isn't anything there in other countries. And, so just finding out that ability to depend on some of those resources and build on those and really help people maximize what's available to them is key, because we forget to be extremely grateful, I think, for some of those things that are available that are not in other countries' structure.
Could you talk a little bit about how important those programs are for getting people out of poverty? Right, because it's not necessary that people are sitting on these, for a lifetime, right? But by having these programs that help people through tough times, that helps them move further up in the income ladder?
I can do that, but I don't have the facts and figures in front of me. So this is just sort of rough. But I do know that SNAP itself, the Supplemental Nutrition Assistance Program, is one of the great indicators of economy righting itself. And that is because if you look right now, the use of SNAP has gone down, and it continues to go down. It was at its height, I think, in 2010, which reflects the 2008 economic disaster, I guess it's fair to call it. And it was at its height, but it has continuously and appropriately worked its way down because more people are able to support themselves and their families and move away from that support system. And so, and there's lots of discussion about, is that really accurately what that reflects? But best estimates are that it really is a really good inverse relationship to the economy, and that it kicks in when it's left to being delivered as it was originally or subsequently designed. It is most responsive when the need is high, and it fades back into less need when economic times are better.
So what are some of the ways, besides, on a macro scale on the economy and things like that, what are some of the ways on a local scale you assess the effectiveness of some of these programs?
Well, one of the ones I mentioned, the Expanded Food Nutrition Education Program, is one that is really a hallmark. It was created in 1969. I think it was Orville Freeman was the Secretary of Agriculture at the time, and he wrote a letter to Lyndon Johnson, who was president, and said, "Mr. President, there are people in this country who do not know how to feed their families, and they need the information that," and this is his words, "that extension homemakers would, give them at a meeting, but these people are not likely to go to meetings. So we need these educators to go into the homes and to work with the families one-on-one." And that's the way that program was started back 50 years ago. Well, the beauty of that program, and the reason it's still alive after 50 years, in my opinion, is because in the 80s, before anyone was calling for evaluation, I was not in it then, the program developed a very complete evaluation system that looks at a family's practices pre-program and then post-program, and also addresses other aspects of their behavior that change over time. So instead of just how did you like the program, it really is these are the changes that we have made as a result of the program, and that has been able to allow our program to really sort of continue prove its impact through the years. So that's one example.
It's really obvious, I think. Well, maybe it's not obvious, but it should be obvious to people, like how nutrition matters for health, right? But could you say something more about like the other impacts, right? Sort of what difference is there for a family, right? Sort of when they improve their nutrition, and it's just like in terms of just calories, in terms of sort of the vitamins and micronutrients, and sort of like what impact does it have on people overall in terms of well-being and yeah.
Some of the micronutrients are simply, all of them have an ability to change life, but some of them are truly intergenerationally life-changing. And what I'm thinking of is iron. The capacity to learn is increased exponentially when a child has enough iron in their diet during the formative times in their life. And so we talk a lot in maternal child nutrition about the first 1,000 days, and that is during pregnancy, from the time of conception, during pregnancy to their second birthday, and that is really key for optimal nutrition. So, and there's lots of nutrients that we talk about, folic acid, because we know that if it's missing, and that's most typically found in fruits and vegetables, but it can also be added to lots of grain foods. It's a B vitamin that's going to prevent many of the neural tube defects that we see still in other developing nations. And so that one is really key. So having a varied diet with again, one of the main things we talk about is increasing fruits and vegetables, because nobody, no matter what economic range there, nobody eats enough. It doesn't matter. It's not a message that's targeted at this audience or that audience. It's like, you can be safe if you say eat more fruits and vegetables. So there's folic acid and vitamin A, which is either beta carotene as a precursor in fruits and vegetables, or in the actual formed version in animals, is one of the main causes of blindness, lack of vitamin A in the developing worlds. And so, some of these nutrients that are not that difficult to obtain in foods are really lacking across the globe. So when you're talking global food systems, it's like, yes, the macro giant commodity type, making it work, and even down to the farm and making the farm prosperous, but down to the individual and down to the whole cross ability to just figure out the necessary foods to be on the plate is a key part, I think, about what I think of when I think of global food systems. It's that mega, but taken down to the mega number of individuals that benefit from it. And I don't think I answered your question completely, but iron, vitamin A are two of the biggest ones, and probably those are some. And then there's different populations and different ones that are specific to where they are. But those are two of the ones globally that are particularly in infant and maternal and infant.
Yeah, no, that was great. That answered my question. I think great, because it's not, again, it's not just about calories, right? It's not just about, right? So there's so many things that are important.
It's so important to get out of this country, and no offense to this country, but to talk to people who really, until just recently, and most of them still don't talk, there is no talk of obesity, because people are struggling to get enough enough. And so it's really hard for people to get their head wrapped around buying and eating or growing and eating a variety of food, because more to them means more of the starchy, center of their plate food, whether it's maize or whatever, that rice, whatever that food is, that gives them that full tummy feeling that they are able to have enough to eat and their kids are able to go to sleep. And so to introduce a concept of varied diet is really beyond the scope of a lot of people's thinking at the individual local level. And so having some of those local educators that can put it in perspective that resonates with those families is key.
You talked about sort of getting some of these nutrients from a variety of sources, and obviously the varied fruits and vegetables is a great way, but supplements to grains and stuff, right? And so in this country, we've got a lot of experience of additives, right? Vitamin D in milk, and the list is long, right?
Yeah.
Sort of what's your view about, or do you? I don't know if you have a specific view about this, but what do you think about the difference between adding essential nutrients to food, like through a manufacturing process, or like improving, shortening the cooking time through extrusion, like ahead of time, versus like trying to get these nutrients, and your calories, and sort of increasing the cooking, making things more easily available, like through other methods, right? So like basically, should we just be trying to eat more fruits and vegetables, or is it okay to sort of set up a system where, hey, we need certain things, let's get it into other parts of our food, so we don't have to worry about the fact that we're not eating enough fruits and vegetables?
I don't think it's one or the other. I think it's a mix. I remember seeing in Kenya, and they stopped the bus after about the fifth time. I made them stop, and so I could hang out the window and take a picture of this sign that said Ken salt, and it's iodized salt, and it's like, that is huge. And we are one of the only developing nations that doesn't require that iodine be in all our salt. We have the option of it, but we have the freedom to not pick iodine too. So we do have, in some cases, reoccurrence of goiter. and in developing nations where they have iodine added to the salt, it's a simple fix, relatively simple fix for a problem that is
significant health issue.
Yeah, forever and ever. And not only is it goiter, but it's also cretinism in developing in infants. It takes a different form when it's birth and young children. So it's a simple fix, and it's an inexpensive and complete coverage of people to get that nutrient that they need. I feel the same way about folic acid. It really corrected a lot of things. I think we're starting to find out now. I think that there are some sort of individual age-related, folic acid. More is not always better as you age. There's some issues. It looks like that there can be too much, and it may affect heart health. And so to have it across the board in every every cereal or bread may not be the best solution, but it certainly solved one of the huge problems that we saw in our country and worldwide too. So it wasn't just the U.S. So I don't really think there's, as a dietitian, I'm programmed to say if we can get it through our diet, that is probably best. But we know population-wise that there are several nutrients that we cannot get adequately, easily through our diet. Even in this country, during pregnancy, it is difficult, if not impossible, to get enough iron for women during pregnancy at the level that is needed. So that's one of the main things that's almost always included in a prenatal vitamin. And it's simply because diet-wise, it would be very difficult to do that at a time when many women aren't feeling like eating enough, let alone more to support that particular nutrient. So I think it's a mix of, if we can get it from the diet, great. But if there are ways that we can affect health of populations through appropriate supplementation, then I think those need to be pursued.
And fruits and vegetables in particular, fresh ones are expensive, right?
They are.
And it's a
They
major
are.
issue
And
for
they're seasonal. I
Right,
mean,
yeah.
we've got issues. We can talk about that across Kansas, and you may be able to get them in the southeast corner, but the northwest, And when we talk about fresh, how fresh is fresh, it's different if you live in California, and it truly is grown right there versus, it's shipped in and brought in, and so you can have fresh, something at your Western Kansas grocery store. So
how quickly do things lose their nutritional value?
A lot of them are losing, like vitamin C, and some of those are really volatile. They'll go away shortly after they're harvested, and so ideally we'll tell people that canned food may be inexpensive, but it's picked at its peak, and it's captured. The nutrition is captured at that point, and so we encourage people that instead of thinking that everything ideally is fresh, that you have a variety of food and that you not worry about it being, we have a healthy, very complete food system, that you not worry about it necessarily being organic, and it doesn't necessarily need to be fresh, because foods are picked and packaged at a real optimal nutrient level.
Could you say a little bit more about food access in Kansas? I think a lot of people think in the United States that food is accessible to pretty much anybody, right? Because a lot of people have cars and that sort of thing. But depending on your situation, access to a grocery store might not be possible, right? Yeah,
exactly. And this is something we talk about a lot in our programs and extension. But I think food access is a really big part of it. And in Kansas, we have areas. And even in our county here in Riley County, we have areas that food access is not easy. And when you think about that, there's two components to it. There has to be a place where food is provided, like a grocery store, but then you have to have the financial support to be able to access the access. And so you may be you may be several miles away from a grocery store, but it's not a food desert if you have a car and you can hop in your car and go to the grocery store as many times a week as you need to. But if you don't have access and there's not public transportation and you don't have the money to make that happen, or you're working hard to get the money, so you have two jobs and the store closes while you're still at work. And the same is true if you even count on a pantry, and the pantry only serves people in one county, and you work in that county, but you live outside the county because the cost of living is less there. And so you've got access problems that, we best intend to fix things and help things, but we create some of those as well, sometimes with our systems. And so it is not that difficult to identify what we call and now I think they're starting to develop new terms, but food deserts where food access is more limited than you might ever think in a country with this much to offer.
Yeah, and you said even here on campus, hidden hunger is a real issue more than you would think on a university in a relatively prosperous area, right?
Yeah, and that's something that people much smarter than me have been aware of for a while, but. We have a Cat's Cupboard as a food pantry that has been available for the last couple of years because it was identified that as costs go up for college students, they may be able to, live in a very expensive area, or they may be able to hold down a job or two to make their tuition and books, but sometimes that last thing that is covered is food, and they'll go without the variety or the quantity of food that they need to stay healthy. And it was identified in several different ways from several different directions that was not only an issue here on our Kansas State campus, but on many campuses across the country.
One thing I wanted to make sure that we covered while we have you here. You talked about for young mothers and young parents and child nutrition and things like that. It's important for them to get things like iron and folic acid and whatnot. What other things do you think young parents should keep in mind, or you wish more people understood about child nutrition?
Oh, you just touched on it. Now we're here for the rest of the day.
That's great. As long as you need.
One of the things that I've been partnering with another extension specialist, he's in family child development and nutrition, is I've had a real focus for a while on parenting through feeding. And I think that's a real important aspect of it, is that the whole idea of adequately nourishing your child's not only nutrient needs, but their whole just educational and emotional support oftentimes happens through parenting, and parenting is always on display, if you think about it, during feeding. It's a give and a take, and so I early subscribed to the idea of an educator. She's a registered dietitian who also has a master's in social work and has spent her life counseling families on feeding problems with children. And her name is Ellen Satter, and she has developed what she has come to call the division of responsibility in feeding. And basically, she's saying it's up to the parents to choose to provide healthy foods in a safe and dependable setting for the child. But it's up to the child to decide how much food to eat, or if to eat at all. And so thinking about that and working with parents, if the child has the responsibility of how much to eat and whether or not to eat at all, that means that instead of prodding your child to, oh, just take 2 bites, just take a bite, clean your plate, or whatever the current dialogue of the day is from parent to child, instead of doing that, we trust the child's appetite and the fact that they are programmed to grow, and we do other things. So we make the setting, I'm not saying that it's an entertainment, everything's always perfect. Not that at all, but it's a a functional, very positive time where kids feel supported as they learn to navigate food and their own eating capability, to become eaters that are capable. And we work a lot with parents through programs to sort of instill that strength in them, and then to also understand that what they're looking at may not just be, picky eating. There are other things that it can be around, and how to sort of arm themselves with information and some tools that might help them pass through some of those challenging stages.
Is there some research out there that sort of shows if you allow the child to make these decisions over time that they do develop faster, or they get the adequate nutrition that they need, rather than trying to force it on the child at any particular time?
It's not that they develop faster. It's that they become competent eaters, and so they trust their own ability to start and stop eating, to have the ability to say, I don't care for that, or I don't feel like eating now. I'm not going to eat anything. And that's not a time for mom or grandma or granddad to freak out. It's the child has that responsibility to be able to say that, because we know as parents that they're going to eat when they're hungry. I mean, there's a few ground rules that we understand about him. They're going to eat when they're hungry, and that, if they go on let's say they go on a food jag, and they only will want to eat one food for a period of time, you offer a food that that they like in addition to new and different foods, and you continue to offer foods. You don't make a big thing about it if they're only, going to eat one food. And so you kind of, yes, there is research, and that's the whole point. There is research that shows that by doing that, you let them know, kids know that there are boundaries, that they can be cranky and obstinate, and food is still going to be on the table. They're still going to have that interaction and that support from their parents. And so it really gives them sort of this this framework for success. And it shows that there's all sorts of research on this, but it shows that when children are very little and they're brought to the table and they have this sort of responsive parenting, feeding, they develop their vocabulary better. They interact. They learn communication skills earlier. As teenagers, they're less likely to have delinquency behaviors. They're less likely to have drug use, less likely to have nutrition food disordered eating. And so there's a ton of research out that shows that if people develop, young people, kids develop into competent eaters, that a lot of the issues that come along with that have a food sort of framework to them can be avoided.
So this is interesting on so many levels, but this is all about the social part of delivering food, right? It's not about what you're delivering as much as how you're delivering it and everything, right? This is interesting because when so much of what we're talking about with global food systems, production and then sort of whatever, but sort of food is complicated, right? And and it's so social, right, and cultural, right? And this is, I think, an important part to be highlighting. And man, battles between parents and kids around food are
job security.
Right. That's right. It's always going to be happening. So obviously, you said no, food doesn't become punishment. I heard you say, right? So it's always going to be there. All right. So it was always hard for me as a parent, right, not to sort of do a little bit of that forcing. I mean, I think we tried to do something that was kind of like this. We said our kids aren't going to starve. They'll eat, right? And we're not going to make something just for them. We're going to make what we're going to make, and they can choose to eat it or not. And so, we felt pretty good about that. But man, there were so many times I'm like, no, you got to eat this, right? And I don't know, how do you handle that balance?
It's sort of built into us, it's like, I made this for you. And it's sort of, it still comes out. But I think just even if you are only, cognizant of it, and 90% of the time you try to do that, it's just remembering that the for what lack of a better term, the Clean Plate Club or the 2-Bite Club, which is interesting. There are well-meaning books coming out from all different directions that talk about that, but that is
always trying at least 2 bites, of something? Yeah, right.
Because see, that's infringing on the child's responsibility, is to decide how much to eat or if to eat at all. So if we can just say, here's what I'm offering today, and you can have, you can have this or this. So there's choices involved, but you control that the food is healthy. You control that it's offered regularly, so the child doesn't have to wonder where their next meal comes from, and you keep the discussion. It's not about punitive, and you keep the discussion light and positive. That those are very positive aspects, not only of eating competency but of parenting.
I was just going to say it's fascinating to listen to you describe that and to the impact that has, the effect that has as the child grows. Expanding that out just a little bit, what are the guidelines if the child 30 minutes later comes back and said, I'm ready to eat now?
Well, according again to Ellen Satter, that's one of the things that you do is you can say, okay, you don't have to eat this, but your next opportunity, you'll have a snack at 3, like we always do, and then there'll be supper. So
define the ground rules, and that's okay.
And so there won't be the opportunity to come back and demand something in 30 minutes or dig in the snack drawer or whatever it might be, so it gives parents a break too, because you have sort of this set of things that you can, because nobody wants to screw up their kids eating. But when kids aren't sure that where the next meal is coming from, or that they, can trust themselves, let's say that somebody is so worried about some child's weight that it's like, no, don't eat that, or don't take more, you've had enough or something like that. When you're overdoing that part of their responsibility, it undermines their ability to trust their own satiety. And so there's instances in settings where kids will just eat because they're not sure that, they will get a chance again because, it's been restricted or something. And so there's lots of cases like that where, and that can be normalized, but it then, there's feeding clinics and parenting feeding clinics and all sorts of manifestations of trying to get that message through to parents that it's really, and when you think about it, it starts at the very beginning. If a child is breastfed, they can't be force-fed. They are able to say, I've had enough and I don't choose to eat right now from the very beginning. And so if an infant that's just born has that capacity to do that, we need to nourish and support that as they grow to be competent older eaters too.
So are there trade-offs there? Is there evidence that also like that trying of different foods increases their palate longer term, so that like actually if you force some new foods on them, does that actually have benefits or no?
No, I think trying and forcing is the key right there.
Yeah, okay.
There are, and I this changes all the time, so I can't tell you, but there are windows where offering different foods are less likely to be rejected, and so to try a variety of foods on a regular basis and to re-offer and to be okay if by trying this food today, I'm going to lick it, smell it, and, set it really close to my face and look at it for a while, but I may not eat it till next time because the senses all come into play at the same time, and so it's not necessarily taste is the one that's going to win out. But yes, by offering a variety and then being real calm about the way that food is offered, or that that it can be rejected without upsetting mom. I can reject the food, but mom's not going to reject me because of that. And so being able to feel confidence in making those choices and not upset that family relationship is key in a child's development.
You mentioned the role of breastfeeding in sort of setting up healthy child development, and you did your PhD on the effects of breastfeeding, correct?
Right.
Could you say a little bit more about the science behind that and the importance of it?
Well, if we weren't going to be here all day before, we are now. Yeah, it's just pretty amazing. All the things. What I particularly looked at with my research was back in like early 2000s. Was the effect of prolonged breastfeeding on child overweight. And there's a lot of research, and we used big data from WIC and looked at data sets for Kansas infants, and those who were breastfed at least 6 months started to show some real protective effect against overweight at age 4. And age 4 we use because it's the nadir before they introduce in schools and get other outside food things. And so, and since that time, it's been repeated and reaffirmed in a lot of different places. And that was actually taking Kansas and looking at it because there had been a nationwide study that didn't include Kansas, and so it used WIC data. Looking at that audience where we knew that we had at one time we had a higher incidence of child overweight in a WIC audience than in a generic across the board 0 to 2 audience. And so so there's that, and then there's all the nutrition support that's much stronger, and the fact that so many things are available through breast milk that we're just still struggling to continue to find what it means and should it be added to infant formula even to this day. And so and then the whole nurturing and the child's ability to be in charge of their eating. There's just a myriad of benefits to it.
What are the mechanisms to protection against being overweight? Is that
and that has changed over time too. Okay. They used to think that it was. I need to check these again. They used to think that it was something enzymatic, I think, or something. But now they're starting to think that maybe it actually is some sort of genetic or DNA sort of programming early on. That's a programming thing. And I am not as up to date on the information as I used to be, but they have started to have more thinking, and I think that it's actually they're thinking that programming for satiety sets in early or something about. But I mean,
it's got to be really, really complicated. I'm sure we don't like you just said. We still don't really understand everything that's happening through breast milk.
That's the beauty of nutrition. Right, it's really relatively young science, and so a lot of this stuff, just like the biome and
I was just going to ask if the microbiome is
they're just starting to figure it out and to really attribute some of the science to some of the changes and the autoimmune diseases and things that come out. They're just starting to put some of that together. So it's
which is another whole aspect of food that's sort of, it's not then just even about the nutrients, but it's about sort of what else are you getting when you're eating, right? Sort of what other microbes, right, are you getting?
What does it do in your gut when it's
and what's it do to your gut once it's in there? And it's great. It's so I wanted to ask. I keep on talking here. I'm sorry, but asking you questions, but should let other people say things too, but sort of you just said of something about nutrition being a young science, and sort of, all right, so one of the first things I think people think about when they, I don't know, but sort of with nutrition science, one of the things that I hear when I talk to people about science communication, right, nutrition comes up as one of these examples. Well, first they said it was this, it was bad for you, and now they say it's that, and then it's sort of, and then this is fat and sugar, and it's sort of butter and margarine, and it's all these things, and sort of they don't know what they're talking about, right? So what do you think about this? Because I'm sure
the whole reason I got into the field is because it's so interesting and it's still evolving. It's like, I think we're at our most boring when we think everything is solved and we've figured it out and let's move on. And so I think that's a perfect example. When I first started out in dietetics, we actually, fat was the evil, and if I would have ever thought that I would get to the point where I would think that, dairy fat now has got some really sort of very positive properties that they're starting to find out about. And, avocados and nuts and all these things that way back, it's like fat, ew. But such healthy types of fat and the effect of different kinds of fat and what it has to do. And one of my favorite ones to use an example of that, and I love doing it when I'm talking to an audience of seniors, is like, remember eggs? Remember how eggs used to be the criminal? You were right. Eggs are back. They're positive. And then just the other day I saw something. It's like, well, maybe dietary cholesterol is a problem. And it's like, man, don't go there, because we're finding out now all this stuff about choline, and eggs are one of the best sources of choline. And choline is like this nutrient that's been around since the 1860s, but they're just starting to figure out that it may reprogram some of the biome, and have, that we need different levels at different times during our life, depending on whether or not we're making estrogen as women in childbearing years. And so it's like, this is really fascinating stuff. So so eggs, they're good right now. And I love talking to people about that, but I like getting them to the point where they understand that it is a young science. So we were just figuring out vitamins back in the 20s and 30s of 1920s and 1930s. So stuff is really relatively young. And I just threw out a textbook, I think I told you this, that it was 2000, and it was saying, don't try to attribute anything to choline, because it really is a nutrient that doesn't have any use in the body. And it's like, holy cow, if somebody gets a hold of this, that is so not where the research is now. So to me, that's the fascinating part. But I do understand that it frustrates people. But I think, since the fact that we eat every single day, many times a day, most of us, to be able to sort of tweak our eating pattern as nutrition changes shouldn't be that foreign. It's not like we're going to find out that we got a bad car and we have to live with it for 10 years. You can make adjustments to your nutrition as you go along, and it shouldn't be that sort of much of a jolt to people to sort of learn and adapt as they go along. But again, I guess that's sort of job security for nutrition educators.
For you, yeah. So this is there's always uncertainty, right? And there's uncertainty in like all science, right?
Yeah.
Sort of like all, yeah. Right? And we make mistakes, right? Scientists, so that's important. So but one of the things this brings up is sort of the question, like, when do you turn the science into policy, and when do you as a extension specialist turn the science that's out there into a recommendation? Because that's kind of where some of this can go wrong sometimes, yep. Right? Sort of, we've got the science, it's uncertain. Oh, so eggs, maybe not, fat, whatever. But then it comes down like, reduce your fat. And I think one of the issues that you just hinted at was that sort of too often we take those directives way too seriously, too extensively. We don't tweak. We're like, all of a sudden too early, we're gone. But sort of how do you balance that to sort of, like, how soon do you start to make a recommendation? How confident are you in recommendations? How do you handle that?
Also, to add to that, I mean, we're all genetically different, right? And we all have come from very different backgrounds. We had different childhoods. How do you think about that too? Because there probably isn't one policy for everybody.
Right.
Yep, and I think that one is just really, starting to unfold. I think we're really just starting to learn about that, and I think that, for example, choline is a perfect example of that, and I think gluten may be another one, where it's going to react with different people, and they're going to have different sort of reactions or reprogramming actually from some of these nutrients. And so,
do you get a lot of questions about gluten?
Oh yeah, that's one of the lessons I wrote a few years back was on gluten when it was going from. Because again, when I was in school, they talked about celiac. Very few people have celiac. This is something you may need to know about if you're in a clinical setting. Learn about this. And then to the point where, let's all try it. It's a great weight loss diet, and everywhere in between. And so I, just a few years ago, felt like it was time, and there was lots of stuff being developed out there to write this lesson on, okay, here's all the reasons that we know of today why you might need to talk about gluten-restricted diets, and there's allergies in addition to, and intolerances in addition to celiac, and there's all these things. And then, is it effective for a weight loss diet? Well, in extension, we try to, really not be black, white. We weigh the science. We talk about it, and it's like, no, it doesn't seem to really be effective just for weight loss, and it's super restrictive. You lose a lot of nutrition in the offing while you, throw the baby out with the bathwater as far as, getting rid of gluten. So, yeah, we get a lot of questions about that. Vitamin D is another one. There are people in research out there that say that vitamin D is the solution to a lot of things, that whether it's autoimmune diseases, all sorts of things that are being attributed to vitamin D at some level. But the research supports only bone health right now. That's where the science is most complete. We've had recommendations that we increase it during pregnancy. It's pretty exciting stuff, but they're not there yet. So what we end up doing, what I think we are bound to do, and at least in these two programs, and I think it's just good sense, is we follow those U.S. dietary guidelines for Americans. Those are put together by really strong, appropriate groups of people who look at the science, see if there's enough weight to the science at the current time to say, we can now say this about this. If we can't say it, we can say it's looking like this, but the science isn't there yet, so this is all we can say. Like about vitamin D, they really can say bone health. There's all those other things that they are starting to attribute to it, and depending on who the scientist is, there's tons of pressure to make some of those changes. But you have to weigh the science and make sure that, and that's when something becomes, research, even applied research versus public health policy. And so it's a continuum.
We want to be respectful of your time. Maureen, Scott, do you have any further questions?
This has been a great
It's been a
conversation.
really good conversation.
Thanks.
We really
Thank you.
appreciate it. Do you have anything else that you would like to say before we sign off?
No, I think I appreciate the opportunity to talk about more things than I ever thought we would be talking about today. I hope I've done well by extension. Extension is a very huge and complex system, and my slice in family consumer sciences is part of it. So, to talk about extension and their focus on the grand challenges, one of which is global food systems, I think really merits a bigger look than what I was able to share with you.
Well, and if people want to get in contact with you, how might they do that?
Just Procter, Procter at ksu.edu. That works out well.
Great. Dr. Sandy Procter, thanks so much.
Thank you so
Thank
much.
you.
You're welcome. Thanks.
If you have any questions or comments you'd like to share, drop us an email or check out our website at kstate.edu/research/global food. Something to Chew On is produced by the Office of Research Development at Kansas State University.